So what we did in this is we drilled down a little bit further into that question and asked the specific activities within asked about the extent to which the specific activities within this gear are enacted. So this shows the results for the first gear, for the analytics and population insights that we're discussing, right? So each stacked bar is one attribute or one specific activity within that gear. And the blue line shows the mean scores um, for each one of these attributes, right? So we see the first stack bar is using clinical administrative data and conducting descriptive analysis with EMR data, for example, or other data sets. We're at about a 3 there. So the mean says we do this sometimes. Patient-reported data analysis, a little bit higher, 3.29. Qualitative data analysis, a little lower, 2.43. So in between, we're starting to do this, and we do this often. So similar range. And Walter is adding that this is a pilot result. This is, yes, this is results taken from 2 pilot studies. Correct, 100 and plus respondents have completed the survey so far. Data modeling, that pertains to predictive analytics and machine learning. And so a little bit more advanced techniques and in data analysis, equity analysis, ability to whether or not we're systematically identifying inequities through our data, and then engaging with partners across these analytic activities. And then the colors illustrate the variability of answers, right? And so typically it indicates the percentage of respondents who indicated each response type. And so red, let's just say, to simplify, red is typically bad, we're never doing this, and blue is good, we're doing this more often, right? And so this type of data visualization can help us identify which are the specific areas within the gear that we're not doing so often, and to help prioritize what it is that we want to get better at, right? And so whether or not we want to improve data modeling in the short term or using AI and predictive analytics and machine learning is something that the team can debate, whether it's a short-term or long-term goal. But certainly equity analysis, for example, was something I would recommend this sample of participants to focus on. We have 43% saying that we never do this, 1.71 mean, so we're in between, we never do this, getting close to starting to do this, but not quite at 2, right? So that would be something that this team could focus on based on this type of analysis.
Yeah, thanks a lot, Victor. And these are sort of being brought here as exemplary of the ways we could ask this in our Chair Health team. So we just asked you the very general overview question, but actually there are more detailed. And so you can see the more difficult to do things are happening a little less frequency, at least in our pilot studies.
We didn't quite break 2, right? So the highest score the mean score we obtained in this pilot was a 2. So we're starting to do this. Again, in this gear, we drilled down the evidence synthesis into the specific activities that we've mapped. So this has so the first one is about defining specific questions that will guide your evidence synthesis and that are aligned with your quality improvement objectives and that are well defined. The use of appropriate evidence synthesis methods, and we define those in the survey question. And then the third one is about using evidence synthesis in your improvement and change initiatives. And then the fourth, and this is present in all of the gears, it's about engaging a diverse area of partners throughout your evidence synthesis activities, right? And so in our assessment here in this pilot, we can see that the biggest gap is apparently in the evidence that this is a method. So in using methods, 71% of people said we never do this. And lowest mean score, and there's a opportunity for improvement there. But throughout the year, no one indicated that we do these things often, or we do this nearly all of the time. So this signals that there's a fair amount of opportunity for improvement here in evidence synthesis based on the findings from this pilot test. What we had in our sample here is a little above 2. So the mean score for engaging with partners for co-design, that's our first activity in this gear. We believe that is the key component, the most important aspect of co-designing, is engaging with the diverse group of partners that are representative. So 2.29 in our sample. And then using co-design methods and techniques, we got a mean score of 2 with some variability. And then the last one, it's about this activity. So mitigation of participation barriers and ensuring that power imbalances are explicitly addressed. And so that's the one we see the most variability in our samples responses, right? And so if you were to prioritize here, I would potentially focus on co-design methods, and the third one, we have a 2.29 mean score, but there's a wide range of variability. So 14% of people said we do this often. No one said we do this nearly all of the time. But that variability might indicate that in some areas this might be occurring in the organization, and others aren't. And so in other pilot tests, we were able to compare these data across different programs within the health system. That's important to be able to assess where it might be the case that in some areas, in some programs, we're doing this often, and in others not so much. Here are the mean scores. Again, we separated this question into specific components of implementation. So the first one is about that alignment between the solutions that we co-design and aim to implement with the values and the workflows of the people who will be impacted by change, right? And so we're really trying to get at that alignment between the solution and the context in which it is to be implemented. So a 3, a score of 3 means we do this we're doing this often. So some opportunity for improvement, but overall that's been perceived to be enacted well. The second stack bar is operational support for implementation. So whether or not we have the expertise and available supports and staff to facilitate that implementation action and projects. And so engaging with frontline providers with that implementation expertise and providing adequate technical and technical support. The third stack bar is about leadership. So whether or not leadership provides the adequate resources, but also accountability, incentives, time availability. So whether or not that leadership, both the quote unquote soft and hard aspects of leadership are there to support implementation. That's a 2.86. So in all of these, we're sort of in between starting to do this and doing this sometimes, which I think is a little lower than our poll indicates here. And then the fourth one is engaging with partners for implementation. I think that is the most, that's the question that most aligns with the poll, and 2.3 in that, and we have 14% of people in this pilot test sample indicating that we never do this. So that could also mean an opportunity there to focus on ways that we could engage partners a little bit more during implementation initiatives. I think the pilot performed Slightly worse. There was no participants indicated that they do this often, or nearly all of the time. So we have these mean scores. Again, we drilled down on the evaluation aspect, on the evaluation gear. So we asked about evaluation methods specifically, and whether or not those methods are robust and rigorous in being able to capture the right data and assess those outputs. We asked about evaluation agility and frequency. That received a 2.29. So evaluation methods, there's just a significant opportunity there. It scored the lowest, so that's something we might want to look into for this sample size. Let's go to the third one. So using evaluation findings to change practice. 2.57 has scored the highest, but still 57% of people said we do this sometimes. There's opportunity for improvement across the board here in this sample size, in this with these participants, right? Scope of evaluation, whether or not we are evaluating against the quadruple aim with an equity lens, and whether we're measuring all of these dimensions that we want to improve on. That's what that fourth bar is getting at. And again, engaging partners for evaluation. So there's opportunity for improvement across the board here with this sample. I want to iterate that this is meant to be an to illustrate how these findings are could be presented, right, with this tool that we are iterating and developing. So this provides you with an illustration for how we could do this for EuroHT if we were to we use this tool and assess capabilities against the framework. In the tool, if you recall, when I presented the tool, we allow for people to provide open-ended comments. So we provide that opportunity so that people can provide statements and comments. And so for each one of the gears, we collect, valuable statements that highlight some opportunities and strengths, which we can then translate into potential action plans that, as a team, we can then prioritize afterwards. So for example, for the analytics gear, participants highlighted inadequate staffing and high turnover. So for example, for work that impacts my area, inadequate staffing and lack of succession planning has been one of the many barriers for researchers requesting data for scientific investigation. So that's a people-related problem with analytics. And so some of the actions we could investigate is we could pursue our are exploring what the root causes of that high turnover could be. Maybe develop a succession plan and resources to facilitate new hires or training materials. So that could be an area of focus so that we can ensure that continuous ability to use data and collect data and mitigate that high turnover, for example. And so other things that people commented on were lack of resources for qualitative data analysis, and not just not just opportunities or weaknesses or negative or even barriers, but people also commented on successes and strengths. And so for the evidence synthesis, one participant highlighted that they had a robust approach and process for developing guidelines and recommendations, with expert panel step and including patients with lived experience. And so that might be something that we might want to disseminate. And so that best practice could be disseminated across. This was a large organization. And so disseminating those best practices that have been developed in specific programs and areas could be a good strategy to enhance performance and breaking silos, right? So disseminating those best practices. And then for the co-design, the last year we heard there was an opportunity to engage with diverse with patients, families, and caregivers. And that could be an opportunity here for us to pilot test and figure out how to do these things, how to co-design with patients, and then disseminate best practices. So a lot of the issues can be addressed by action, right? How do we if we're not doing so well with co-designing with patients, let's figure out different ways of doing this, and then learn from our co-design efforts.